most of the audience probably works in life course epidemiology in one way or another, so I'm saying what you already know, but in life course studies we focus on distal exposures, for example, social disadvantage in childhood, and we want to relate them to some later event, later in adult life or maybe midlife. And as we do this, we really think of a conceptual framework where there are lots of pathways joining this distal exposure to a later outcome. And for example, a simple conceptual framework may involve education achievement and health in childhood through some psychosocial pathways. So what we really are after disentangling the underlying process, and this is mediation analysis. However, although it's a simplified version of reality, still is very complicated. And my talk will actually consider something much simpler. We'll really discuss what we should be concerned about, even in a simple setting when you have a single exposure X, a distal outcome Y, and one single mediator M, where there may be some confounders influencing each of these elements of the triangle. And in this setting, what we will want to know is how much of the effect of X is mediated through M, and by mediated we mean the causal effect of X goes through M before reaching Y, and that's what we call indirect effect. And we want to separate that one from the direct effect. And with direct, we mean the causal pathway that does not include M. It's not really direct. It's only direct in the sense that it does not involve M. And this is an important point that makes all, my previous more realistic example far more complicated. What is a direct effect? What is indirect? But at the moment, let's just concentrate on one mediator and separate what goes through that mediator and what doesn't. And those are the direct and indirect effects. So in this context, simple triangular setting, I will just compare two approaches of analysis of mediation. The standard approach to the more general framework based on causal inference, and go through the example and the summary. So what does a standard approach, at least as applied in epidemiology? We will first consider the simple setting without the mediator, where we have our X and our Y, and then some confounders. And we will probably fit, for simplicity, consider a Y which is continuous. We will fit a linear regression model for the expectation of Y given the exposure and the confounders, where there will be some parameters gamma. And in this equation, gamma X would be interpreted as the total effect of X. It's interpreted as such because we are assuming that the confounders have all been measured appropriately, and they include all possible associational relationship between X and Y, which are non-causal. The next step in epidemiology, at least, is then to include M in this model, and to include M as an additional explanatory variable in the model for Y, conditional on X, then M and C. So now we have M included in this regression model, and we have a beta X. And an interpretation in epidemiology is that beta X represents the direct effect, that is the effect that is not mediated through M. And then the difference between beta X, which is this direct effect, the total effect, the gamma X of the previous slide and the beta X of this slide, the difference, which I call here delta X, is taken to represent the indirect effect, the effect mediated through M. And you would reach the same conclusions if you came from not from a substandard regression analysis, but from structural equational modeling, where the rules of path diagrams could be applied and would lead to exactly the same parameters, where delta X, the indirect effect, would turn up to be the multiplication of the regression parameter on this side of the triangle times the regression parameter here. And it turns out to be exactly the same as gamma X minus beta X. It can be demonstrated algebraically. So this is the standard approach. And as I said, we may want to consider something more complicated. Why? Well, there are at least 4 limitations of standard regression analysis. The first one is that those calculations and those interpretation of parameters as direct and indirect apply only to a simple linear regression model where the outcome is continuous and where there are no nonlinear terms. In particular, if you had an interaction between exposure and mediator, those interpretations of the parameters fail. If you had quadratic term for M, this relationship would fail. If the outcome were not continuous but binary or Poisson or accounts or survival, this partition again does not work. You cannot interpret the equivalent parameters, say in a survival model, as if there were causal direct and causal indirect effects. Third, it is not generally appreciated, not even in the structural equation modeling literature, that these calculations, even in a simple setting, will lead a continuous outcome, no interactions. It's not appreciated that there is an implicit assumption that there is no unmeasured confounding between M and Y. So a lot has been understood about the importance of controlling for confounders in general, but not so much about these relations M and Y. And you may say, why are we interested in these confounders when the two parameters I've introduced you to, the gamma x for the total causal effect and the beta x for this sort of direct effect, they're not really relevant. They're not really touched by V. But in fact, it can be demonstrated, it takes some time, that the beta x estimated from a model like this, if you ignore the interaction for a moment, is not if in the presence of an unmeasured V, the estimate you obtain of beta x is not the direct effect, but it's a mixture of the direct effect and some spurious additional pathway from x to y. So that's the third reason. Then there is a fourth reason, which is still related to confounding, and it's a particular type of confounding represented here by the letter L. L here is a confounder between M and Y, but I take it to have it measured, so the previous criticism does not apply. It is measured. However, in some settings, L lies on the causal pathway from X. And this is very likely to occur in life course epidemiology, where there are long stretches of time between X and M, M and Y. And in between X and M, there is time, and there could be that things actually that are confounded in this relationship actually are on the causal pathway of X. This is what we call intermediate confounders. So L is a confounder, which is a confounder in a sense because it, if not accounted for, would lead to a biased estimate of this relationship. But it's intermediate because on the other sense, it's part of the direct effect of X on Y, because if I follow without shaking the red line and then the black line, you can see this is a pathway that does not involve M. So it's part of the direct effect. But if we fitted a model to deal with the confounding of L, now including L down here as well as C, what we obtain with beta X is only this part of the direct effect, while the true direct effect also should include this. So we are not getting what we want. We want the direct effect of X. But if we fit a model that deals with the confounding due to L, we are removing part of the direct effect. And this is the major limitation, really, of the standard approach of to mediation analysis, which had not been appreciated, not even in the structural equation modeling literature, but that Jamie Robbins and his colleagues have really addressed with a whole battery of new approaches. And this is what I'm going to talk about in the next point. But first, can I just check if there are any questions on this aspect? John?
This is different from correlated errors you're talking about, because the correlated errors are covered in structural equation modeling.
So L could be a way of representing correlated errors between M and Y. It would be equivalent. But this would be a correlated error which lies on the causal pathway of X. So it's a variation on it. So maybe my example will show that this is quite realistic. But time is pressing, so I'll move on and then we can discuss more deeply. So what is the alternative? The alternative is to adopt modern causal literature language and a conceptual framework. And because this allows, as I will show in a moment, to define direct and indirect effects in a way that is free from a particular model. So my first three criticisms of the standard approach is that they depended on a particular linear model for y with no interactions and no nonlinearities. But if we use this approach, we are free from that constraint. So we can deal with any type of outcomes, any type of mediators, and we're not restricted to the linear relationships among them. The second aspect, so the novelty, is that if we want such level of generality, we also need general definition. And the way to come to this general definition involves unmeasured, unobservable entities. And in this setting of mediation analysis, it's not just potential outcomes to which you're probably already familiar, with which you're already familiar, but also potential mediators, because we need to think of alternative worlds where things may be different from what we have observed. But this is the complicated aspect, introducing in our definitions potential concepts, but also has the advantage that forces us to state our assumptions. And let me just introduce the potential outcomes that I'm going to use next when I introduce the definitions of causal inference mediation estimates. So I will be using three types of potential variables. The potential outcome y, little round brackets, little x, will represent the value of the outcome that could have occurred had the exposure taken the value little x, possibly counter to the fact. So that's why they're called also counterfactual. So it's whatever y would have been had x been white instead of black, although I've only observed black values of x. The same is valid for m, so m little x is the potential mediator that would have occurred had x, the variable x, the exposure x, taken a particular value, little x. And then in mediation analysis, we have to introduce this complicated composite outcome, which is the y of little x and little m, which is the value of y, the outcome, that would occur if the exposure took the value little x and the mediator took the value little m. Now, I will use the definitions, and maybe hopefully this notation will make sense. And I will assume, for simplicity, that the exposure takes only two values, 0 and 1. And I will come up to the various definitions. And I will start with the total causal effect, because that's something we are all familiar with, and that maybe that will allow us to imagine the worlds involved in potential outcomes. So what is the total causal effect, the average total causal effect of an exposure x that compares a value 1 with a value 0? So the TCE, total causal effect, expressed as a linear contrast, is the difference of the expectation of what y would have been if everybody be exposed, minus the expectation of the y that would have been if everybody had not been exposed. So we are comparing two worlds. We are not going to observe these two worlds. We observe partially these worlds as people are exposed or unexposed in our data. But conceptually, we are saying, what is the difference if everybody had been exposed relatively to everybody being not exposed? And this is the definition of causality. Of course, we could define all of this on different scales, as odds ratios, risk ratios, rate ratios, but at the moment, I will just use linear contrast to define the causal parameters. Now, now I'm going to introduce two mediation-specific parameters. There are several that have been introduced in the literature, but two are the most popular, and those are the ones that probably act as good introduction to the field. The first one is the control direct effect, CDE, which is a function of little m, as I'll explain in a moment. So what is this contrast? Again, it's a contrast of two different worlds, two expectation of values of the outcome. In the first case, we consider a world where everybody is exposed, but everybody has the mediator fixed at a certain value, little m. Say that the mediator, as you will see, is in my example, is size in childhood. let's assume that everybody weighs 10 kilos or whatever. So everybody takes exactly the same value of the mediator, but we change the exposure from 1 to 0. Again, we have a contrast of worlds, hypothetical worlds, and this is a direct effect because we are keeping M to be the same. So we are blocking the indirect effect by saying there is no variation among the individuals in our hypothetical population with regards to their mediators, but there is variation in exposure. Obviously, this varies as you change the value of M. It's not necessarily the same. So if the children are 10 kilos or 15 kilos or 20 kilos, maybe this contrast will change. And that's the limitation of the control direct effect. So the alternative is to use another definition, which is called the natural direct effect. And this has a similar format of the one before, but there is a big change in the second term in each hypothetical world. So again, we have a contrast of two worlds where everybody is exposed and everybody is not exposed in this half of the equation. But now, instead of fixing everybody to have the same 10 kilo value for the mediator, we are saying that everybody takes his or her own value of M had they not been exposed. And this is called the natural value of M. So we allow each person to have a different value of that mediator, but we imagine a world where there is no really indirect effect, where the whatever X is, the mediator is untouched and remains at a value as if the individual were unexposed. So it's still a direct effect because we are still comparing two worlds where the only thing that changes is X. But every individual, so the M is the same within individual, but is not the same across individual because people may have different weights according to their exposure. This definition seems slightly more difficult to grasp and in fact had met lots of criticism in the literature because this first term makes you imagine a world which is impossible. In the other definition, you could imagine a world where everybody is exposed and a world in which everybody is unexposed, but you cannot possibly create a world where everybody is exposed and at the same time the mediator is not affected. So that's the source of criticism, but there is a big advantage of this definition because it allows you to identify the indirect effect, because the difference between the total causal effect and this natural direct effect leads to the natural indirect effect. So you have a complementarity between this parameter and the complement to the total causal effect that can be interpreted as indirect effect. And we could show it sort of algebraically again. So what do we do with this? Well, first of all, I will say that I will concentrate on natural effects because of this property, and also because in life course epidemiology we are really interested in separating direct and indirect effect. We want to apportion what percentage of the total effect can be attributed to the mediating factor. So then maybe we can intervene and do something to control the effect of M in some way. So we'll focus on this natural effect. Very briefly, I could spend half an hour now about the assumptions required to identify this parameter, but I'm not going to because I only have 7 minutes, or less maybe, within 5. But just, it's suffice to say that if you recognize our initial diagram with the CDL and this, what we need to assume to identify these parameters is that there is no unmeasured confounding between X and Y, no unmeasured confounding between M and Y, which is something we have already established earlier, but for the natural effect we also need no unmeasured confounding between X and M. So we need really to know the structure of the problem to be able to believe whatever we estimate out of this setting. And in addition, from natural effect, there are further assumptions and some model restrictions which are required. Again, just a flag to say, be careful if you go down this road, but it's worthwhile thinking about it. Finally, in terms of estimations, there is a choice of ways in which these parameters can be estimated. It could be fully parametric through G computation or semi-parametric through inverse probability weighting and G estimation. Now to the example. Eating disorder in adolescent girls. Well, very briefly, I'll go straight to the diagram. We are interested in the effect of maternal size before pregnancy and to the eating disorder in adolescence of their daughter. Trust me that we have thought about confounders, we have thought about, which are not drawing here, but in the analysis we have accounted for. But the thing why this is interesting is that we want to know whether size of the mother before pregnancy is important, whether it is mediated through how big the girl is in before puberty and during puberty, and how this size in puberty may influence her eating disorder symptoms and therefore diagnosis. Here you see size. I've highlighted one confounder, an intermediate confounder, because size at birth obviously is on the causal pathway from maternal size, but also is potentially a confounder between childhood growth and eating disorder, because it could be related to eating pattern, genetic features. There are lots of reasons why that could be so. So the question I'm trying to ask will be addressed using natural, direct and indirect effect, because I really would like to know what's the effect of intervening on maternal BMI, and whether this has, if I could intervene on this, let me just go back. If I could intervene on this arrow here, maybe by doing some policy that minimizes the obesity epidemic in children, would I reduce the causal association that I presume between maternal size and eating disorder? We could discuss whether that's causal or not later on. So that's what I'm asking. The details are here. The data come from the ALSPAC cohort, collaborated with a psychiatrist who interviewed girls when they were 13 and a half about interviewed the parents when the children were 13 and a half, and she identified 3 latent dimensions of eating disorders propensity score. So really propensity to be diagnosed in later ages, because in fact eating disorder is diagnosed only when they're 16 or 17, not earlier. So these are precursors of the disease. So we have 3 dimensions: binge eating, fear of weight gain, and food restrictions, which were the 3 dimensions picked up by the interview to the parents. Our exposure is the pre-pregnancy maternal BMI, which we categorize into underweight, normal weight, overweight. So we have an exposure which has 3 categories. The mediators is childhood size in terms of BMI, and we have measured it in 2 dimensions. This is also another powerful aspect of the potential outcome framework. We are free to define a mediator as more than 1 dimension. And we defined it as the BMI of the girls when they were 7, as well as their rate of increase in BMI between 7 and 12, so in the pubertal years. So we have a bivariate mediator, we have a categorical exposure, and 3 outcomes. So it's quite complicated. And in small letters, details are given. But I'll go straight to the figure because that will eat up most of my minutes. So to clarify, we have 3 outcomes: binging, concern about body shape, and restrictions. And we have 3 levels of exposure. So if you focus on the right-hand side of this figure, I'm just showing you the comparison. These are the total causal effect when I compare a world where all mothers are overweight versus a world where all mothers are normal weight, and what that effect has on the score, latent score measured by the psychiatrist. So all these values are positive, greater than 0, because the scores are standardized, normally they're standard scores. So having if all mothers were overweight, you would expect an increase in scores in all 3 dimensions, so they go in the same directions. On the left-hand side, I'm comparing a world where all mothers are underweight versus mother normal weight. And you can see all the scores are low. So overall, there's a protective effect of an underweight mother before pregnancy. Next, I'll show you the estimated natural indirect effect, which is how much of that total effect is mediated through childhood growth. Now, on the right-hand side, we have nearly an overlap. They're saying that most of the total effect is mediated by how the girl grew during childhood and pre-adolescence. While for the other part of the world, we have the actual total protective effect that we have observed is actually shows that the indirect effect through the size of the girl is much stronger, it's much more protective. So if smaller underweight mothers lead to children who are smaller, and that's act as a protective effect on the eating disorder scores. However, when you I'll show you here the direct effect, which is the one not mediated by childhood growth. As you would expect, the direct effect is 0 for over here because there was total overlap here. But now we have a harmful direct effect on maternal underweight, and the explanation for that is probably the psychological stress and other probably mental health disorder of the mother. We are investigating other variables to try to pinpoint why there is a double contradictory effect of underweight. So in summary, harmful effect of maternal overweight, completely mediated by childhood growth, protective effect of maternal underweight, but that is reduced by a harmful direct effect. Obviously, there are lots of assumptions underlying here, and this probably will be the focus of the attention. But my conclusion, life course epidemiology involves studying processes, hence understanding the issues underlying answering such questions is very important. There are two approaches. Traditional approach has several limitations. The modern approach is general, more formal, and harder to grasp. I know I made your life difficult, but it is difficult even taken slowly. But my message is that it's worth learning about the causal approach, because if we want to ask questions as complex as this, we need to face the difficulties of defining parameters that make sense. So pretending it's not difficult is not safe. Thank you. And I have some... Thank you.